We are presenting the article, Reduced Lower Extremity Functioning is Associated with an Increased Rate of Being a Non-Driver from the National Health and Aging Trends Study. Caitlin Harthcott will cover the introduction, Julie Donald will cover the methods, Madison Smith will cover the results, Keelan Henson will cover the discussion, and Megan Pry will give us a few clinical applications for this study.
Some background information for this article is that driving is a huge aspect of being an independent adult. It is common knowledge that as one ages, driving declines in response to health decline, which includes physical function. Some things that contribute to a decline in the ability to drive cannot be changed, but there is a physical factor that is modifiable: lower extremity function. The purpose of this article is to compare scores from the Short Physical Performance Battery, which is an outcome measure, to current non-drivers and drivers, to see if there is a correlation to lower scores from the outcome measure with reduced function in lower extremities in non-drivers with a national sample of older adults. Some abbreviations that are used throughout this article, one being which Short Physical Performance Battery, which is abbreviated SPBB, measures function, National Health and Aging Trends Study, NHATS, which is a cohort that was used as a longitudinal design, and strengthening the reporting of observational studies in epidemiology, abbreviated STROBE. This article was used for the reported standards, confidence interval, abbreviated CI, and non-Hispanics, abbreviated NH.
5,935 participants were selected from those participating in the NHATS from 2011 to 2014. To be included, at baseline, you had to be a current or previous driver, be living in a home or residential care center, and data for the SPPB must have been recorded for you at least once during the 4-year period. Those that had never driven or had comorbidities that had prevented them from driving were considered non-drivers and were excluded from the study. Lower extremity function was assessed at each wave using the SPPB scale to measure balance in standing, gait speed, and repeated chair stands. Each of the 3 components was recorded using a scale from 0, meaning the participant was unable to complete the task, to 4, the best possible performance. The scores from each of these 3 components were added to yield the total SPPB score, which ranges from 0 to 12, with poor being 0 to 5, fair being 6 to 9, or good being 10 to 12. As previously stated, the SPPB measures lower extremity function by measuring balance, gait speed, and chair stand tests. Standing balance was assessed in 10-second intervals with the participant standing for as long as possible in parallel, semi-tandem, and tandem stances. Gait speed was measured using the time it took the participant to walk 3 meters from a standing starting position. Chair stand test results were recorded as the amount of time required for the participant to rise from and return to a seated position with the arms crossed over the chest. This study was longitudinal in design, and every year researchers measured the SPBB for each individual and recorded their reported driving frequency over the past year to classify their driving status for that year. The researchers also identified other factors that could affect driving status, such as age, sex, dementia status, and other comorbidities, as well as others. These were adjusted for in the data analysis, which was a multivariate Poisson regression in order to avoid skewing the data.
So what did this study find? What they found is that even after adjusting for covariates that could have impacted the participant's driving status, there was still a significant association of low SPPB scores and being a non-driver, with the percentage of those who were non-drivers increasing in a stepwise manner as SPPB score, and therefore lower extremity function, decreased. For example, those with fair SPPB scores were 1.31 times more likely to be non-drivers than those with good scores, and those with poor scores were 2.01 times more likely to be non-drivers than those with good scores. The p-values for this data are all less than 0.001, meaning that the data is statistically significant, and the adjusted 95% confidence intervals indicate clinical significance. Next, we will discuss these results.
The study used 4 years of data, and an unmodified SPPB was administered using strict protocol, which helped to maintain standardization across the field. Findings indicate that there is a significant relationship between SPPB scores and driving status in older adults. Participants with poor to fair SPPB scores had an increased rate for being non-drivers when compared to participants with good SPPB scores. Research indicates that physical therapy can improve SPPB scores for older adults, and the use of SPPB during routine physicals could expedite the treatment of at-risk populations. The limitations for this study include dates for non-driver status were only assessed during the first round of surveys. It is possible some individuals were no longer driving at the time of the survey but were misclassified as current drivers, as they could have driven at some points in the past year but were no longer driving at the time of the interview. In addition, participants that were classified as non-drivers were not questioned about a possible return to driving. Additional variables such as fear of driving and socioeconomic status were not assessed and were not available in the National Health and Aging Trend Study datasets.
As physical therapists, we can infer a large amount of information from a patient being a non-driver. Driving cessation may result in substantial implications for the older adult in regards to mobility, safety, and overall health. Treatment from a licensed physical therapist can be used to address some of the common modifiable factors that may contribute to an older adult becoming a non-driver. These modifiable factors include strength, specifically in the lower extremities, mobility, balance, safety, and overall physical function. According to this study, participants scoring fair or low on the short physical performance battery scale were at an increased risk for becoming a non-driver. We can identify patients at risk if we incorporate the SPPB in our physical therapy evaluations. This will allow us to prevent a patient from potentially becoming a non-driver in the future. Research suggests that interventions led by a physical therapist can not only improve scores on the SPPB, but can also decrease the likelihood of road incidents and motor vehicle accidents among the elderly population. Further studies correlate older adults driving fewer miles per year to an increased crash rate. This is called the low mileage bias hypothesis and can be due to decreased fitness. As physical therapists, we have a large potential role in keeping older adults safe on the road.